Good evening, Facebook viewers. Welcome back to our 10th edition, as a matter of fact, of Holzer Updates. I'm Melissa Davis, the Director of Corporate Communications here at Holzer, and joining me tonight is Dr. Mike Kennedy, CEO here at Holzer. So thank you for joining us. As promised several weeks ago, our commitment to you was to bring you updates as we received them, and if there were any changes in our community area or within our health system, our commitment was to bring those to our patients and community. And so tonight we want to cover three big items. We want to first talk about the situation locally with COVID-19 and the reopening of our communities. We also want to talk to our Holzer patients directly and what they can expect when we're providing care and when they're coming in for visits. And then we also want to answer your questions live. So many of you have submitted questions prior to tonight, but I would ask that if you do have questions, go ahead and type those in the comments below. We actually have monitors here that are keeping track of those questions. And so if we don't get to your question tonight, rest assured that we will address that question with you. We know there's a lot going on right now with reopening, with travel, with school, with many things. And so we just want to make sure that we're able to answer those questions for you. So, Dr. Kennedy, thank you for coming back again and doing this with me. Let me ask first and foremost, what's new and current locally in our area?
So things have changed a lot. I think it's probably been 6 weeks since we did one of these.
Yeah.
And at this point in time, there are over 86,000 cases confirmed in the state of Ohio, 6,000 in West Virginia. In our service area, the counties that we serve, 731 confirmed cases. The thing that's changed the most since the last time we were doing these is our ability to test. We have tested over 5,000 patients.
Okay.
Of those 5,000, 5,254 exactly, but as of today, in-house, our own testing, not sent out to LabCorp or Quest or one of the other companies, 4,952. So way over 95% of the cases that we are testing are done in our hospital, our own collection and testing services. So our lab department deserves a great round of applause if we were able to do that for them. They've done a heroic effort to get that done. About 50 cases in Gallia County, 41 cases in Mason, 23 in Meg, 62 in Jackson. Athens has 330. We've seen a big surge in Athens County in the last few weeks. And I think over the state of Ohio, what we were seeing when we were doing these a few weeks back was 300, 400, 500 cases in Ohio per day. And now we're seeing 1,000, 1,100, 1,500 cases a day. So it has changed. We're going to talk a little bit about the masking mandate later on, so I'll save that.
Okay. So yes, things have changed, and some of those I think have been surprises, a lot have not, but we want to address your concerns with those this evening. So we know kind of what's going on in our area, but I want to talk too about our Holzer patients specifically. What for upcoming appointments and procedures and things, what does a patient need to know before they ever pull into the parking lot here at Holzer?
So the main thing is everyone must wear a mask. The whole state of Ohio is under a mask mandate by the governor at this point. Now, he has caveated that by saying there are medical reasons why some people can't wear a mask, and we shouldn't judge those, and we shouldn't. In my opinion, there's a very small percentage of people who actually have a real medical reason not to wear a mask, severe respiratory problems and things like that. I am deeply of a deep belief at this point that if everybody that could wear a mask legitimately wears a mask for 4 to 6 weeks, we could really stem the tide of this. Good news is the numbers are going up as far as cases, but of those numbers, a lot younger patients, hospitalization rates haven't gone up dramatically, mortality rates haven't gone up. At this point in time, based on the state's designation of Gallipolis and Gallia County as an orange level 2, we are not allowed to have visitors in the hospitals. There are some exceptions, again, as we've always had with pediatrics and OB. We have limited entry points. We're still offering masks and making sure people have masks at those. And in the patient care areas, the clinical areas, everyone is wearing appropriate PPE. We have seen and taken care of patients in our facilities as patients in the hospital with COVID. And It's been fairly seamless. Our staff has done an excellent job using the PPE when necessary. And the fact that we can test quickly in our own facility and get results back in less than 24 hours has given us the ability to really minimize the use of PPE when we didn't have to. So those are the things that are going on here in the hospital.
So that kind of leads into the next question that I had for you. So we've seen an uptick in cases, like we said, some higher in some counties than others. If you would drop in the comment and let us know what county you're watching from or what county you reside in tonight. We always like to go back and look at those comments. But as you've mentioned in the past, the uptick in cases isn't necessarily a surprise for us at Holzer. So how is Holzer preparing for that uptick as it relates to both community and then protecting our employees as well?
Well, we're doing all the things that we talked about, still doing checks at the entrances. And internally within Holzer, we've actually made the break areas and the dining areas a little more socially distanced. We're trying to create situations that actually make it almost hard to do things that are unsafe to protect our folks from getting spread at work. But the number of cases that have increased is not really a terrible surprise. In fact, there is one theory that we saw the numbers start to go up when it got really hot in early June and the humidity ticked up, and that forced people inside, air conditioning. You know, I grew up in Tennessee. We stayed outside as long as we could because we didn't have air conditioning, and it was hotter inside than out, but we all have air conditioning now. So air conditioning systems were not created to filter things. They were actually created to be more efficient by recirculating the air. And so forcing people back inside with the heat, recirculating air with HVAC systems is maybe responsible for some of it. I don't believe anybody thinks this is a second wave as much as it is just a continuation of the existing process.
Okay. So anything in particular that we're asking patients to do, anything specific that they can do prior to coming?
The more they can connect with us, the better they are. If we can connect with them before an appointment, we can get them pre-registered, minimize the time that they have to spend waiting in areas with other patients. And obviously we socially distance those areas to the best of our ability. But if you just ask about how to connect with us, it's not hard to do, and we prefer it that way. That's the most important thing they can do, is just reach out.
That's a great suggestion. And from where I sit here at Holzer, I would say if we've learned anything throughout these times is that we can never be too connected to our patients. And so I want to share with you 3 ways that you can connect with the folks here at Holzer Health System and can help us help you stay connected with your health care. So the first of those would be to join the patient portal if you haven't already. You can register there at myholzer.com. And you can do a lot of things there. So you can ask your provider questions, you can request prescription refills, make appointments, and do several things there. So myholzer.com would be probably the single most important thing that you could do as a patient prior to coming. In addition to that, if you're watching us now, you have found us on Facebook. I would ask personally that you share the posts that come from Holzer so that others in the community can be made aware as well. We want to be a resource to our patients and community. And so Facebook is an excellent way for us to get information to you in a timely manner. And then of course, our website is holzer.org. And there you will find many resources, whether it's things like a change to the visitor policy or being able to ask questions there or look at additional COVID-19 resources. Everything can be found there at holzer.org. So those are the 3 ways that we would ask that you help us to stay connected to you. All right, so several questions tonight, so I'll get down to it. The first one is, as an expecting mother, one of our patients that submitted a question, Brittany, asks, can my partner attend ultrasounds and OB appointments with me?
I would say a qualified yes. We certainly try our best in situations with expectant mothers to have the partner there if at all possible. And unless there was some reason that the partner couldn't wear a mask or something, I think we would make sure that could happen. I don't really see any problem with it. Again, qualified, yes. Right. But we are asking again that everyone wear a mask coming in. And I might take a break here and talk about how to wear the mask. We don't have them on right now. We're 6 feet apart. It's hard to talk and be heard without the mask on. The mask is not meant to wear like this, which I see a lot. Mouth partially covered, nose not covered at all. The mask to be effective, and again, it's not effective protecting me, it's effective protecting others from the possibility that I might have it and not know it. But the mask has to be completely up over the nose and under the glasses. People complain about their glasses fogging. It does happen, but you can actually, if that really bothers you, you can get some paper tape or even cellophane tape and put tape over the top of it that prevents the air from coming up and fogging the glasses. But the mask, if they're going to be worn, they should be worn properly. And so I'll say that.
All right. Words from the surgeon there. So, and we should also make the statement that any answers to questions are relative as of today. And so a lot of policies and protocols here at Holzer are constantly changing as a result of what's going on throughout the community. But that's how it stands today. I want to talk a little about travel. We've received several travel-related questions over the past couple of weeks. So can you offer some guidance on things that we should consider before and then also during travel?
Sure. The safest thing to do is to not travel unless you have to. But having said that, even when the governor announced his new travel advisory, it's not a mandate, but there is a travel advisory. And he's listed a certain number of states, and it changes on a weekly basis based on the number of percentage of positive cases in those states. And I think there are 7 or 8 states on that list right now. If you travel to those states and come back, he is recommending, not mandating, but recommending that you self-quarantine for 14 days. Okay. There is a difference between quarantining and social distancing. And I think there's a lot of confusion there. And if you make a decision to travel to a high-risk area and potentially have unsafe situations, then you should expect and plan to quarantine when you come back. Quarantine means you stay at home. You don't go to the grocery store. You don't go to the walking trail. You don't go out in public where you could potentially come in contact with others. That it basically means you have been in a situation which could potentially have exposed you without you knowing. Safe social distancing is what we do on a daily basis in order to allow us to continue to work and do the things that we need to do. And that's 6 feet, masking, indoors particularly, outdoors if you can't maintain the 6 feet, good hand hygiene, and all the things we've been talking about for months now.
Sure.
So.
Okay.
But the travel advisory, you can go coronavirus.ohio.gov and find out all the information that you need about the travel advisory. So having said that, even the governor in his comments made it clear that travel could be done safely.
Sure.
And I think there's a difference between driving to a destination and flying to a destination. There's a difference between living in or staying in a house or isolated condominium and having access to a beach where you're not going to be in contact with other people, still getting carry out instead of going to restaurants and bars. There are ways you can do things as safely if you have to travel as you can do at home. And so he again, it's not a mandate, it's an advisory with a recommendation. So
okay. So you mentioned a little about quarantining and then self-monitoring. So for those of us that may have traveled and then returned and are self-monitoring even, what does that look like? What should people be looking for during that time?
They should be exquisitely focused on their own symptoms. It's easy to think, I got the sniffles, probably just allergies. If that's all it is, that's fine. But if you're feeling bad, if you're achy, if you have a fever, and if you're self-monitoring, you should check your temperature at least twice, if not 3 times a day. If you bump up into a low-grade fever category or something along those lines, that's self-monitoring and being aware. That doesn't mean you have to stay at home all the time, but it does mean that you need to be very careful for several days. Usually a week or so of self-monitoring is what's appropriate. But, those sorts of things.
All right. So along those lines, if a viewer, did feel, actually, we had a viewer write in that says, what should I do if I start feeling sick? Do I go straight to urgent care or should I go straight to the emergency department?
Well, obviously, we've talked about this before. The answer is
Yep.
neither of those. Please call someone. Call the primary care provider if you can get in touch with them. Stay at home. Stay away from people. Do all the things that we've talked about with respect to essentially quarantine until you can find something out. And, I've heard personally of several cases in the last week of folks that felt bad and maybe had a runny nose or a cough and concerned they might have COVID-19, and they got tested and they were negative. And so it doesn't mean that you have it, but until you know for sure. I've also heard of cases where there's been spread in small community areas. One person was totally asymptomatic and had the virus and was positive. So you can't be too careful right now. It is serious, particularly serious in our elderly and our at-risk population. So those are the things you should do. Call someone first. Don't just show up, and we will help you get to the right place.
We've managed to filter quite a few of those questions from our patients. And I think, too, if they don't have a provider to call, we certainly welcome them to call us, but the health departments in their county as well, to seek some guidance there. So,
yeah, and we talked about testing before, and, everybody that needs a test can get a test. That's different than everybody who wants a test can get a test.
That's a good point.
We are hearing at the state level that some of the reagents for testing are becoming in short supply again because of all the testing that's going on in the Southeast right now. Florida's in the 10 to 15,000 cases a day that are positive, not 100,000 cases that are testing every day or more. So we want to maintain the pipeline of adequate testing for patients who are in a category that need it. And state defines 5 levels. The lowest level of which is just someone who wants a test. And so here we are not typically doing testing on people who just want to test. It's a clinical indication for us.
Sure. Well, that provides
There are places
little...
you can get tests
Sure.
if you just want them. Some of the pharmacies and retail stores are offering those, and there are pop-up tents that are here and there. You can go to the state website and find out where those are.
And I know, the nice thing I think we can offer here at Holzer right now is the quick turnaround time for those tests, because those are now being done on site, where a couple of months ago that was not the case. So,
right. Our turn time is less than 24 hours.
Okay. So another travel related question. Kelly asked, how long after exposure or travel can symptoms appear?
Well, typically 2 to 14 days.
Okay.
As soon as 2 days, depending on the exposure and how strong the viral load that you were exposed to was. It could be quicker, but as long as 14 days, and that's the reason for the 14-day quarantine.
Okay. Another viewer, Lisa, wanted to know, are we still doing surgery, or have those been put on hold for any reason?
Nope, we are still doing surgery. We're back up to a regular full schedule. We're testing all of the pre-op patients 3 days ahead of time to see that whether or not they are positive. We picked up a couple of positives in that, not very many, fortunately, but we have picked up some. And we're back up 95% of our typical volumes for this time of year.
Okay. Barry, another viewer, asked, I own a small business. If an employee of mine tests positive, how long before they are no longer contagious?
Well, they should, from the time that they are completely free of symptoms, usually about 7 days after that.
Okay.
Ideally, you would like to have someone test negative before they come back to work. I'm not sure that's the case in every single situation, but you should be symptom-free another week, and then you probably are safe at that point.
Okay. So we've had several questions from employers similar to that. And so as you continue to send those to us, we encourage you to, even if it's after this live broadcast, we hope to be able to provide. We've had questions from employers. We've also had questions about return to school. And so those are some topics we'll be addressing in future live broadcasts. So we ask that if you are watching this and it's not live, we ask that you drop those questions in the comments as well. A new question is, what is the best way for a patient to get tested for COVID at Holzer if it is recommended or ordered by a non-Holzer provider for a procedure at another facility?
They should call into the hotline.
Okay.
It would depend on a lot of different things. I would leave that up to our lab folks. We may end up sending that one out to a outside lab test if it's for another facility. Not that we wouldn't help out if we could.
Sure.
But those facilities also have their own testing protocols in place.
That makes sense.
They may not require it. Some places aren't requiring testing of every patient that comes in. We are able to do that because we're able to do our own testing here.
Okay. So for this viewer, 1-855-4-Holzer would probably be the starting point, and that way they could get you where you need to be and get those questions answered for that procedure in particular. So I believe those are the rest of our questions this evening. Again, as I mentioned, as we continue to get questions throughout the weeks, we will be sure to bring you information as that comes about. Anything in particular, Dr. Kennedy, that you would like to add this evening?
No, I think that it is a challenging time.
For sure.
And to be honest, I think that we are probably better off to just assume that this is going to be the way that we live for the next 6 to 9 months at a minimum. I think it's healthier to set those kinds of expectations, and then if we come out with a great vaccine, if things change and the incidence and prevalence starts to drop dramatically, we're going to be happier that we're out of it sooner.
Right.
But I think that the more that we can all, it's inconvenient. It's not any fun to wear a mask in places where we're not used to doing that. But I think that we should think of a mask like a shirt or blouse.
Yep.
You don't go out in public typically unless you're on a beach without a shirt or a blouse. And you shouldn't go out in public at this point today for the foreseeable future without a mask. And I think that is the one thing that all of us can do to help each other stay healthy. And my favorite new phrase is, let's all stay healthy together, hold each other accountable. As the governor said, there are reasons why people shouldn't wear a mask or can't tolerate wearing a mask. I think that's the exception rather than the rule. Mm-hmm. And I think that for the most part, people that don't wear masks or don't wear them properly just do it because it's inconvenient or uncomfortable. And it's one of those things, the more you wear it, the more you get used to it, and it's easier. So do the things we talk about. Wash your hands. Don't put your hands to your face with it when they're not clean. Stay away from people 6 feet apart the best you can. And again, wear a mask.
Absolutely. Wear your mask, Facebook viewers. Thank you for joining us this evening. We will report back as time allows, and as updates occur, we will join you back next time. Thank you.
Thanks.